Is there a cure for your dry eyes? We're going to talk about it today with an ophthalmologist. I'm Dr. Brad Weaning.
Sure, just watch Marley and Me or The Notebook. That'll cure your dry eyes immediately.
Okay.
Dr. Paul Zalzal, welcome to Talking with Docs.
We have Dr. Ben Lish here, an ophthalmologist, who's going to talk all about dry eyes, the causes, the treatments, and if there actually is a permanent cure for this problem. So let's start at the beginning. Why do we get dry eyes and how common is it?
So as we get older, our tear production decreases. And as we get older, we also gain other medical issues, including taking certain medications, and that can contribute to dry eye. Also, a lot of people love to wear their contacts. They hate glasses, so they wear contacts 24/7, every day, 365 days a year, and that can damage the stem cells of the conjunctiva that help produce your tears. So you have to be really careful.
So contacts can do that much damage. Long-term use of contact. Well, that should be a video on itself.
Yeah, it should be.
They're contacts.
Sure. I'm wearing contacts right now.
There you are, contacts weaning.
As soon as I get home, though, typically I do take them out. Like at the end of the day or whatever, take them out early.
Very important. Very important. Give your eyes a bit of a break.
Okay, so someone that is suffering from dry eyes, how are they going to know? What are they going to present with? What kind of symptoms will they
So
have?
the typical symptoms is, it usually happens more as the day progresses. Your eyes feel dry, they feel tired. You might sometimes get some intermittent tearing. It feels like the sort of the faucets of the eye are turning on. You walk outside, the wind kicks up, and all of a sudden your eyes are just like tearing like anything. Sometimes they're about itchy, they're a bit burny. Lots of different symptoms. Sometimes just blurry vision.
I was just going to say, so it can affect your vision as well.
Can affect your vision. Number one cause of blurry vision is dry eyes.
Can you still cry if you have dry eyes?
Yeah, you can still cry. You're still producing tears. You're just not producing what we call our basal tear film production. And that means just the regular ongoing tear production that happens every few seconds or minutes.
Okay, so let's talk a little bit about tears. So are tears just water?
No, tears are a special formulation of enzymes. They got some protective factors. They help the surface of the eye work. They help protect us from infection. So they're not just water drops.
Right.
Okay, what about the dry eye drops that you can get?
So dry eye drops just kind of replenish your natural tears. They have some products in them such as like hyaluronic acid. Those hyaluronase will help coat the cornea and keep your natural tear film around and prevent your tears from evaporating quicker.
Okay, so you got the dry eyes. You're concerned, but you're wondering if it's just dry eyes or if it's something bigger. When you go to your doctor, are you going to see your family doctor or are you going to go straight to an ophthalmologist or an optometrist?
So many people present to their optometrist saying they want an update in their glasses because they have some blurry vision, and that's where the symptoms and the signs of dry eye come about. Sometimes you will complain to your family doctor that your eyes feel dry and irritated. Sometimes you'll actually, the biggest complaint with dry eye is you complain your eyes are tearing. Okay.
Well, that's ironic.
Excessive tearing. Yeah, it is. It is. It's like the water jets are turning on.
Dry eye irony.
Okay, so when they look in your eyes, is the doctor going to see anything? Like how do they actually diagnose it?
So we diagnose dry eyes by a few different things. Number one, we can just look at the surface of the cornea. It could have some little punctate erosions. We can stain the cornea with various different stains, and that shows up with the dry eye. We can look for blepharitis and meibomitis. Those are contributing factors. And then we can look at the tear breakup. So we actually get you to blink and count the amount of time it takes for your natural tears to break up.
Oh, like the evaporation kind of time of your tears. Yeah, I heard about that.
There are some formal tests as well where they can check the osmolality of your tears. A little bit more expensive.
Right.
Out of OHIP costs.
Okay, so now you know you got dry eyes. So let's talk about treatment. Where do you start?
So I always start with the most common cause of dry eye is evaporative dry eye. So your natural tears are evaporating quicker. So you want to just produce a better environment. So treat blepharitis. Hot towel on your eye every day. There are various different types of masks, something called a Bruder mask. There's another company, Taya, has a mask. These are you put them in the microwave for a minute under high heat and then put them on top of your eyes. Do that for 5 minutes. Clean your eyelashes. Tell everybody, just like a lady removes mascara or eyeliner, clean the base of the eyelashes, baby shampoo, makeup remover, again, a lot of commercially available treatments, and then just use artificial tears. Any brand, they all work well. You have to pick one that works for you 3, 4, 5 times a day, and then omega-3 fatty acids, so increase your intake of fish and fish oils.
Okay.
Okay, now in terms of the drops, there are drops that ophthalmologists often do not recommend, like the red eye drops and things like that.
So the most important thing is everybody always says, I use Visine. And Visine is a great product, but there are 5 or 6 different types of Visine.
Okay.
Do not use the Visine to get the red out.
Okay.
Because that's the one that actually causes more red eye. You
Okay.
want to use Visine to get the dry out.
And
The
there is a specific group of people who want to get the red out of their eyes, and you know who you are.
Hey now, don't comment on lifestyle here. We're talking about eyes. That's the red eye irony.
Yes, it is.
Okay, you said blepharitis a few times. Can you just define that for the viewers, not me?
So,
sure.
blepharitis is an inflammation of your eyelashes. So right along the eyelid margin are little eyelashes. Little oil glands, they get inflamed and plugged, and that can lead to a fair bit of eye irritation and dryness.
Okay, so the blepharitis can lead to a plethora of eye problems.
Are there any more serious causes where it would require some type of intervention on your part, like a blocked tear duct or something like that?
So again, if people have very severe dry eye, they can have damage to the cornea. Sometimes we'll look if you have an underlying health issue, like a rheumatologic issue, very common to get dry eye with rheumatoid arthritis or lupus, connective tissue disorders.
Right.
We do have some prescribed topical dry eye medications, cyclosporin, so Restasis and Sequa. Another company called Bausch & Lomb has a drop called Xiidra. These are prescription eye drops to treat dry eye. Sometimes that doesn't work. We have to block your tear ducts to keep your tears around a little bit longer. Very rarely we take some of your blood and create something called serum tears, and those are for people with very severe dry eyes.
Wow.
Okay, so this could be a symptom of a systemic issue. So that's what the whole workup is required for.
Exactly.
I know.
I
It
know.
is certainly spirited on a milder form because of my contact. It is frustrating, and you do feel like your vision maybe isn't quite as focused as it needs to be. So now you know. Now you know the causes and the treatments. And if you like this video, please like it, subscribe to our channel, share it with someone that you know that has dry eyes.
And remember, you are in charge of your own health.
And thanks, Dr. Billings, for joining us and sharing all your thoughts about dry eyes.
My pleasure.
See you next time.